hand over. Thank you very much, Marcia, and now we're looking very much forward.
You see my screen?
Yes, looks good.
That's great. So thank you for the intro, Marcia. Hi, I'm Polina, once again from my side. I'm a co-founder and CEO of Smilamind. And before I start, also a couple of words that I would like to share about my personal founder journey. As Marcia mentioned, my background is business and strategy, and we have been working on the project for about 2 years. Before that, I was in strategic account management at a large software provider and looked after customers in the healthcare industry. And I have seen what is actually possible with technology in different areas. And then I became a mother, and I have attached a great importance to mental health all my life, and currently see the problem clearly in my environment. That's why I got the idea of using technology to support the mental health of those who need it most, children and adolescents. And yeah, here I am, happy to introduce Smilamind to you today, a digital solution designed to help children and adolescents with mental health disorders. Feel free to scan the QR code, Let's Connect, on LinkedIn. It will also appear at the end of the presentation. But now I would like to show you a short video that I think almost everyone can relate to in some way. Doesn't want. You don't see and you don't hear anything.
Not yet, but it worked before.
Yeah, that's
of course always the same with technology.
Yeah, this is not here. Well, this is not tragic because I can. Well, then I will jump. I will jump directly into the problem. So this is actually well known. The problem is well known, so I think everyone nowadays. Various stress factors lead to a high level of psychological strain in children and adolescents, which they are unable to cope with themselves. This has led to a sharp increase in mental illnesses, such as depression and anxiety disorders, particularly among adolescents. 1 in 4 young people globally are experiencing clinically elevated depression symptoms, and 1 in 5 are experiencing clinically elevated symptoms of anxiety. The number of cases is similar in Switzerland. The consequences of these disorders can be dramatic, persist into adulthood, and lead to suicide. There is a major undersupply in traditional psychiatric treatment, and affected adolescents have to wait up to 6 months for a place in therapy. For this reason, and because help is thought very late due to the high level of stigmatization, 80% of children do not receive, and adolescents as well, do not receive the help they need. So new methods and solutions are needed to help those affected and relieve the existing system. At Smilamind, we believe that digital solutions, when they take a sophisticated and evidence-based approach and are used to complement or in combination with traditional psychotherapeutic care, can provide important support for the mental health of digitally native adolescents and relieve the existing system. Our low threshold and discrete solution consists of a wearable, a mobile application, and a clinician portal, and primarily aims to support young people in the early detection and prevention of symptoms of depression. The wearable, here we want to use a commercially available device, for example, Apple Watch, measures vital parameters such as sleep and physical activity. The application displays these vital parameters and gives users the opportunity to actively report their perceived well-being. This is we are doing using, for example, clinical questionnaires and a self-developed mood barometer. AI-driven, we correlate the actively reported symptoms with the passively detected vital parameters and show the young people the interplay between physical and mental health and activate them at the same time to adopt healthy and positive behaviors. We want to show adolescents the symptoms as well as triggers and problem areas, and then suggest suitable disorder-specific self-management courses and exercises to be able to face their problem. To strengthen the health literacy of young people and destigmatize, we inform users about mental disorders and what psychotherapy involves and what to expect from it. Depressed adolescents often feel apathetic and find it difficult to organize themselves and cope with everyday life. So we help them to structure their daily lives with digital diaries and record the experiences and the context of certain events. This should relieve clinicians as well and make their work more efficient. And last but not least, the clinician portal visualizes the data from the wearable and the application and gives the clinician the opportunity to adapt the therapy to the patient needs. In the longer term, we want to develop Smilamind into a medical device that is prescribed or recommended by pediatricians, family doctors, child and adolescents, psychotherapists, school psychologists, and social pedagogues, and reimbursed by the insurance. Here you can see an overview of mocks with some of the functionalities of the Smilamind 1.0 solution. The first mock is a home screen. In the general overview, the second shows the sleep data detected from by the wearable. We developed our own sleep score. And the third is a mood barometer, and the fourth displays activity screen also detected by the wearable device. We measure such things like steps, exercise time, standing time. We have also adapted the screen to young people in wheelchairs. We measure push count instead of steps and rolling time instead of standing time. The green line you can see is what young people set as their goal, and the yellow line is the WHO recommendation. Here are some functionalities that we are currently implementing. A clinical questionnaire that we are digitizing, then the correlations. This is the overview of the interplay between physical and mental health I just mentioned. You can click on individual parameters to see how they developed over the week. We also want to work with notifications and chatbot here to inform young people and motivate them to adapt healthy behaviors. Then we have the info portal where young people can find disorder-specific information. We plan also to add information on eating behavior, for example, or media literacy. This can also help to educate them. And last but not least, you can see the journaling function where adolescents can record certain events and also the context. These are the areas of the use in which we see Smilamind. I will briefly explain the meaning of individual areas. So primary intervention aims to prevent disease before it even occurs. Secondary prevention is where the first symptoms have already appeared and there is a risk of chronicity, for example. Tertiary prevention are the real clinical cases when depression is pretty severe and may also be treated with medication. We are not focusing on primary prevention because that would be the scope of existing stress and well-being apps for children and adolescents and commercially available fitness trackers. We enter the market with the first version of Smilamind 1.0. This would be an evidence-based solution that is used in the context of secondary prevention. For example, when young people are waiting for a place in therapy, or the solution can be used as a relapse prevention. With the first version of Smilamind, we test product market fit, collect data and insights, and personalize our offer and add functionalities that adolescents and clinicians find useful. Smilamind 2.0 would be a further development of 1.0 and could be used in a blended approach, so in combination with psychotherapy. Setting up a business model with a digital health company is a curse and a blessing. On the one hand, you have the opportunity to go hybrid ways and to scale. On the other hand, it has to be a fit in the entire healthcare value chain and comply with regulatory requirements. We are currently evaluating various options. This is one of them. Before I explain the business model, I have to say one of the lessons learned was to test product market fit as soon as possible. You can have the best product, having done the most amazing and scientific important studies that have cost you a lot of money. But if the market does not accept your product, it was all for nothing, and that hurts. In our case, it's the clinicians who have to prescribe the solution and the young people who should want to use it. For that reason, we plan to launch an evidence-based preventive solution to test product market fit. The solution will be purchased directly by the users or their parents. When we understood what our market wants, we will then develop Smilamind into a medical device that will be prescribed by clinicians and reimbursed by health insurances. To use our resources in a targeted manner, we decided geographically to focus on Switzerland and then Germany and penetrate the two countries first. Later, when we have established ourselves in these countries, we will certainly evaluate other regions. I just mentioned the importance of meeting the market requirements. That's why we are developing Smilamind solution in such a way that it can be integrated into the existing healthcare system. To achieve this, the solution must offer added value for the child and the parents, the clinician, and the insurance company, as we want to develop Smilamind to be reimbursable. So the child and the parents receive an easy-to-use, safe and discreet solution that helps them to cope better with the mental disorder. The solutions helps them to provide targeted information to the child psychologist, which facilitate the communication, increase the autonomy, and improve the treatment satisfaction. The clinician or specialist receives relevant, objective and quantified information about the child's condition outside the practice. The compliance of patients and parents is increased as they are more involved in the treatment. The clinician saves time and can organize his treatment more efficiently. And health insurances save costs because the duration of the treatment might be shortened thanks to more efficient information flow, and chronicity can be prevented. This is our current timeline. Although we have validated and conceptualized a lot during our entrepreneurial journey and have involved all relevant stakeholders early enough in our development process, and there's a long way and a hard work behind the concept, we are still at an early stage. I will briefly guide you through the individual milestones. We have completed the development of our prototype and currently testing it in a pilot study with around 50 adolescents. This study we see as a co-creation with our target group, since the young people are giving us a very valuable input on how the solution should look like and what to contain for them to be willing to use it. In this study, we investigated the extent to which vital parameters of wearable correlate with the perceived well-being of adolescents. The study is due to be completed in April, May, fingers crossed, and the results prepared for publication. We plan to launch the first product version Q2 2024 and to start a larger interdisciplinary clinical study with a research organization, a clinical partner, by the end of this year, beginning of next year, to prove the clinical efficacy of the Smilamind solution. In the longer run, as mentioned, we plan to obtain the CE certification and become the first medical device in Switzerland for the treatment of adolescents with depression. This is our team. Roman and myself are involved full-time in the development of Smilamind. Roman works also with a small IT team consisting of a designer, DevOps, and developer. We also have Remo, who is a pediatrician and has a broad network of clinicians and key opinion leaders in Switzerland. Hans Hermann is our data security expert. He's based in Germany. And Jan, who is head of CEO office at Merck, is also based in Germany, is providing us with strategic support. We also have Gisbert, who is psychologist and domain advisor, and Benedict, who is a young politician. And together with his party, he is committed to the mental health of young people in Zurich. Benedict will support us in market access. Last but not least, we have also Nicolas, who is our board president, supporting us in management of the company, bears the legal responsibility. These are our scientific and strategic partners. The Center for Digital Health Interventions supports us in evidence generation and methodology. Marco is conducting the pilot study at Karlsruhe Institute for Technology in Germany, and the Institute for Information Systems at SUPSI is our research partner in the area of data in AI. Startfeld is a network of, for startup support that offers similar services to InnoSwiss with coaching, grants, and financing. And we are currently in discussions to establish a partnership with a clinical partner. So hopefully very soon we are able to place another important stakeholder on this slide. Generally speaking, from my experiences so far, I can say that partnerships in digital health are essential. Be it strategic, scientific, clinical partnerships, or investors. Without partnerships, it is very difficult for small startups with driving innovation to establish itself in the healthcare sector. So my lessons learned, the careful choice of suitable partners is essential, because potential partners can bring you forward, but can also cause you a lot of long-term problems and even make the project fail. I would like to end my presentation with Smilamind's vision. We want to develop an evidence-based digital mental care solution that allows to provide the right type of help for the right child or adolescent at the right moment. It's our goal to be able to predict which children and adolescents belong to risk groups for depression or affective disorders and what concrete measures can be taken to prevent that. Imagine how incredibly valuable it would be. And we at Smilamind truly believe that today's technology, if used correctly, can make this possible. And ultimately, the idea of creating impact with our solution is the driving force that is taking us forward. Having said that, I would like to end my presentation and thank you for your attention. And sorry that the video did not work. It was a mood video about about depression and actually the pain it's causing. But
great, thank you, Polina. This was an awesome presentation, giving a great insight, an overview of Smilamind. Maybe I can start with a question. I think there are also some more hands up already. If you have questions, feel free to raise your hand or speak up or write a question in the chat, and then I can read it to Polina. We can have a look at the chat for that. What was my question? I forgot my question. You did something particular, in my opinion. You opted to do a pilot study very early in your journey. You used the first version, your first beta version of Smilamind to go out into the field and have real participants have a look at it, interact with it for 2 weeks. Could you tell us a little bit more about that and what your first anecdotal evidence or your first insights are from that, what you learned from real users?
Yeah, sure. I mean, thank you for this question. We decided to involve our target group early enough in the development process. We said, okay, it's not just talking about the co-creation. We actually want to make it real. That's why we are doing a study with healthy adolescents that help us co-create the solution and give us feedback how the solution should look like, so that they use it actually. And yes, this for 2 weeks they are wearing an Apple Watch, and they need to log their perceived well-being using clinical questionnaires, some scientific questionnaires, and an own developed mood barometer. So the two most important outcomes of the study is to prove the feasibility and the acceptance of the whole solution, because they need to wear the watch during the night, they need to regularly log the mood, and connect to Wi-Fi. And also to talk about the design, they need to give us, feedback on the design, and then to see the correlations between perceived well-being and specifically detected vital signs. And this is like, it will build a foundation for us to do further the clinical study, to go further and test the solution in a clinical scope.
Cool, great approach.
Thank you. I mean, this is, of course, this is like, it takes longer than if you go this way, but better to invest now more time than later on you're creating something which is not used. And the thing is, we are having a very sensitive target population. So adolescents will just stop using it. As I mentioned, I mean, it can be the greatest product on earth, but if they're bored or something is not working or not user-friendly, they just leave it, and then that's it.
Couldn't agree more. Who would like to start with the question? I don't know who raised his hand or her hand first. Toby. Okay, Toby wants to start.
From left to right. No. No, I first of all, it's just a comment. Wonderful work, and of course, I'm biased because we are a partner here as well. But I see also Akshay here, so definitely have a follow-up, and maybe Marcia can make a connection to Akshay, maybe also to Robert Jacob, who is currently at Harvard and focusing on the prediction prevention of dropouts with mental health interventions. So I think this is also a very important horizontal topic for many health applications. So maybe we can also make this connection to Robert. The blended treatment approach is also something, that we learned can potentially work quite well, which I like very much. You said you would like to start in Switzerland and then maybe expand to Germany. So now in Germany, I know they do not yet subscribe blended treatments. It's primarily standalone treatments. However, there is a very clear regulation and transparent way to be prescribed. Still, you start in Switzerland, which is of course wonderful, and our center and many other researchers are also working hard to make maybe something similar happen in Switzerland sooner or later. So, but why are you like? Is it hard to do these kind of negotiations then with, for example, psychiatric clinics? Because you need, of course, the trust of those medical doctors or psychiatrists that then prescribe it. And thus, of course, it is important to have first studies. But earlier or later, you need probably that randomized controlled trial that shows clearly the effect of the human support and the effect, of course, of the software, the digital therapeutic you're developing. So maybe some elaborations and thoughts on your side on that very challenging way forward.
Well, because you mentioned the negotiation with clinics and the psychotherapists, and yes, they're hard because you're coming there and you're saying, here I am, I have a solution that can help you. And then they ask you, what do you know about my work? In order to able to say that you will make my work easier. Yes, you need to know to gain trust within those stakeholders, but this is the job, this is the homework you have to do before. Otherwise, and this is also the involving those stakeholders early enough. There's just no way that you go there and you ask, you educate yourself, you visit lectures, you read papers, but this is the way to go. Otherwise, it will be very difficult to sell what you're creating. That's why we are. For 2 years, we validate this, the idea and the concept also with the clinicians, with the target group and with the clinicians. So we need to have this integrated approach to bring all those worlds together.
Okay, wonderful. And if it has not been done, so maybe Marcia also can help with Professor Balitza, or you have already maybe that connection.
Yeah, well, she would be amazing, and she would be the perfect fit. The thing is, she's top of the top, and she's extremely busy. So it's also not helping if she's replying once in a month. So we are talking to, I mean, we need to move forward. But it's still, it's still an option. I would love to get the chance to introduce a solution to her, because if she approves it, then then I'm the happiest person on earth. But we are searching for a clinical center, which is, where we see the research focus as similar to ours, and there must be motivation, to push it forward and to design the study the way that it complies, with business requirements and scientific requirements and also clinical requirements. Otherwise, yeah.
Absolutely. Perfect. Maybe last comment on that. Steffi White would be another probably very important person. If you have not met her, we did research with her together a couple of years already. And she is now close to the School of Medicine, or at least in St. Gallen. So maybe she's also a potentially very important target person.
I added her on LinkedIn, and would be happy if she would reply.
Yeah, she's very open to these digital solutions as well. Yeah. Okay, cool. Thank you.
Thank you.
Then maybe next, Juliana.
Yes, perfect. I actually have two questions. Hi, Polina. Nice to meet you.
Yeah, nice to meet you too.
So the first question, actually, I think these questions are also important for our students who are part of the course Emerging Business Models. So you mentioned the importance of partners. And now I'm wondering, at the very beginning, I can imagine that it's super difficult to find the correct partners that you need. How did you do that? How should you approach this problem? And did you prepare something special to approach them? So hands-on tips for students.
So first of all, a profound research of your market, of your industry, who are the key players, who are the key opinion leaders. And then, unfortunately, I have to say this is a trial and fail and trial. So of course you make also mistakes. But there's, for example, InnoSwiss is proven partner with proven quality mark, whereas it would definitely make sense to apply, because they have also experts in healthcare industry, from the healthcare industry. So you can apply for core coaching, for initial coaching, and there are experts that you can guide and support you. Maybe this would be the first step. This is what I would recommend. But yes, to make a profound research of your market, understand the decision makers with whom they are cooperating, and then try to make a list approach and make yourself involve them and make yourself interesting for them.
Very important. And the second question, you showed the two different approaches that you're having, like, for example, the B2C approach I'm wondering about, where you planning to make it available directly for the young people or their parents, you mentioned. And there, the pricing is quite high. So around 20 Swiss francs, I thought that it is. And I can imagine that then the strategy is more making the parents download it for their kids. Or what is your approach there, and how do you advertise it, or planning to advertise it?
As I said, this in terms of business model, we are indeed still validating. This is not very easy. With B2C, well, price, I almost can say just ignore it. I just took available solutions and to make assumption, to calculate around about. Well, also, like, the first version of Smilamind should be used in combination with someone, either be it school psychologists or social pedagogues, or even a clinician who put the adolescent on a waiting list. And then we will not be there yet to make it reimbursable by the insurance. So who's supposed to pay for that? So we have also there we have different options. So that's why, I mean, first of all, we do it direct to customer, but maybe there are other more creative ways. Yeah, we'll see.
A lot for the insights. Very interesting.
By a business model is this is an often question that is coming up. We are even evaluating of giving it for free and collecting data and insight, because this is our actually the evaluation of the company. But then as a Smilamind, we have costs that needs to be covered. Either we find, a partner who is helping us, supporting us also financially, or we need to somehow, we cannot bootstrap forever. Yeah, this is actually one of the biggest pains at the moment, to survive till we make the solution commercial and can live from it. Till then we need to survive.
It's a lot.
Quite brave as well. The next would be Maya.
Hi, Polina. Thank you for your presentation. I
Hi.
have a very practical question. The advisors that you
Is it
brought...
me or I cannot hear?
Oh,
So
I
hear you again. Okay.
okay. The advisors, how are they reimbursed? It's a really practical question that I'm wondering, how do you get them on board?
Well, they are not. They're not getting anything. Some of them are co-founders. It's Remo and Hans Hermann, the pediatrician and the data security expert. They are co-founders, but the others are doing it for free for now. So we agreed with them at some point in time that they will get some money, and now they are contributing to the company's success. Yeah, and then later on they will be reimbursed. So for now, they are bootstrapping with us together.
Okay, thanks. That was all that I...
But again, you need to motivate people and make them believe that it's worth for them to spend their time to share their knowledge, for the solution that they think can be successful.
Okay, thank you.
Sure, you're welcome.
Thank you. And then Akshay is next.
Hello. Thanks
Hi.
a lot for this. This is like super relevant to my PhD. I mean, the health side of it, maybe not so much
Let's
the
talk.
business side. Yeah, we should definitely. But I have a lot of questions, but I'll maybe pick just 3 right now. First was that you're only looking at children and adolescents with this app, right? I'm curious if it also extends to like the general population. Do you think that's possible?
Yeah, this is possible. I mean, of course, but actually in psychiatry children and adolescent psychiatry lives different. It's at different words. So if you you approach depressed children in a different way than you do with adolescents, especially in terms of user design, for example.
Okay.
You put a lot of effort in the gamification, in the structure of the application, and also the wearables data. They are more useful for adolescents. For adults, it's a slightly different approach. We would rather go for other indications, like now they're focusing on depression. We would go to anxiety, ADHD, autism. We would rather go there, but stay focused on the target group and say yes, we have a solution that is targeting and helping children and adolescents. And there are not so many in the market, if not no medical device at least.
So would it be like are they expected to own a smartphone, or do you just give them like a phone with just this one app? Is that the expectation?
They're expected to own a smartphone, but honestly, I mean, we are starting with adolescents, and they are 15 years old, and I do not know any 15 years old adolescent that is not owning a cell phone, mobile phone.
Okay, great. Then the next question was about the the vital signs data that you collect. So does that predict the state of their mental health in any way? Like at least maybe for the clinicians, like on their side, do they see that their vital signs are, and does it make any prediction, or is that for the clinician to decide?
The evidence says, and also what you can read in papers and what clinicians confirm, that sleep and physical activity can be predictors for certain mental state. So not sleeping enough, not moving enough can cause mental health problems. This is what we already know.
Mhm.
That's why we are using a wearable device that is detecting those
Right.
vital
So
signs.
there is that component, like it's actually making some predictions that your mental health is getting worse, or is that happening?
This would be the goal, to make predictions. Now, we need to see, this is
that's my goal as well.
Yeah.
So,
but we're trying to find out in the study. So we can show the predictions, such a word. I would say we are trying to show the correlations between sleep, physical activity, and perceived well-being. So this is what we actually can realize, and pretty convinced that we will succeed there.
Okay, great. And just one final question about the mood barometer that you mentioned.
Mm-hmm.
Is that also detected, or is that a questionnaire of any kind?
This is a logic behind it, behind the mood barometer. I would not like to go deeper, but they can slide their mood. But actually, there is it's a logic that we track it with numbers.
All right, great. Thanks a lot. Great
so
presentation.
we can do the correlations.
Okay.
But if you're focusing on this topic, then feel free to reach out to me, and then we can have another discussion.
Yeah, definitely. Thank you.
Fantastic. Is there another question by Maya? Or did your hands just raised? Okay, cool. Any other questions from the audience that are not covered? Toby has one more.
Of course, because, AI in medicine is such a huge topic. Like, are you planning to use Gen AI or generated content as intervention components in some of your interventions you want to deliver?
In the nearest future, no. I think
because of safety reasons, probably, or?
First of all, safety reasons. We need to comply with the highest standards, and we need to overcome some ethical questions. And we do not think that the technology is there yet to intervene in the mental health solution for this sensitive target group.
Yeah, I assumed so. All right.
Great. If there are no more questions, I would say a big thank you to you for being with us today, Polina. That was really insightful. Please feel free to reach out to Polina. I think maybe you scanned her QR code or via LinkedIn. It was great to have you with us, and I'm looking forward to more work with you.
Thank you.
The near future.
Same here. Thank you very much for this opportunity. A new experience for me, but I enjoyed it actually.
Yeah, thanks a lot also from my side, and let's be successful together.
Yes, create impact.
Thank you.
Okay, then have a nice afternoon, everyone.
Thank you.
See you soon again. Bye.
Bye-bye.
Bye-bye.
Bye.